For the healthy living, we also offer more advanced testing because sometimes when we do just ordinary routine testing, we think the person is doing really good according to the labs, but it may not be the case. So we also offer some advanced testing site and for that to qualify they have to have some indication like hyperlipidemia, high blood pressure, diabetes or pre-diabetes, obesity, because then insurance may cover this test. Medicare also covers this test, provided they have some indication. Now, for example, I'll give example of this patient that has a normal cholesterol. Like you can see, total cholesterol is only 150, and LDL is 103, HDL is also good 44, triglycerides is 82. Now, if you look, the advanced testing that we do is called lipoprotein particles, their size and their type. And in that case, we found out that he has this certain lipoprotein particles, which are small size, are very damaging to the vessels inside the wall because they are small, they can penetrate. Small can have more numbers of particles, so they're more damaging. So those testing help us that actually, even though the number may look good, what is the quality of these cholesterol particles? And that helps us a lot actually. In one of our patients that I have that had lipoprotein particles, lipo A was very high, normal otherwise, very high risk. And we did testing, there was strong family history, and we could avoid the problem in advance. So these testing are very little bit advanced, but now routinely covered on insurance if you have indication. We also do testing, just not just a diabetic screening test, but if you have pre-diabetes, you may be having insulin resistance. So, like this patient, that's the glucose was 107 with the A1C is 5.5. But if you check the adiponectin, which is comes from the fat and helps with the insulin and glucose metabolism, and the leptin comes from the fat as well, which helps to suppress your appetite through the brain centers. Their levels are checked, their ratios are measured as well, with the insulin as well, and their insulin level is high, proinsulin level is high, proinsulin to C-peptide ratio is high. This suggests that patient has a very hyperinsulinemic stage, and that's not very healthy actually. Even the blood sugar is 107. So when person comes and you say, well, no, blood sugar is 107, you need to just work on it, it will not really make any difference in his life. But when you have this number and when they see this red color on these things, then oh my God, I really have a insulin problem. We tell them that you have beta cell function having problem. Beta cells are from the pancreas. You have insulin resistance developing. You better go on some medications like metformin to prevent diabetes developing and improve your diet and lifestyle modification. That person has a profound effect on person's behavior change. We have seen that consistently. I've been practicing for several years. When I say blood sugar is 110, you have to do this. It doesn't really, okay, I'm supposed to be 100, 7 points, what's the big deal? But behind that number, there is already drama started. And once they see that drama, what's going on, they can understand it better. They want to change the lifestyle. They will gonna repeat in 4 5 months time. They understand that. So now to improve those numbers to that beta cell dysfunction, insulin resistance, to bring insulin level down, they work the best. Now in the same patient, we saw that his thyroid functions are abnormal. So we check their T3 level, TSH level, T4 level. Just TSH level may not be good enough. Patients, we check their homocysteine levels are high, suggests that there is a high risk of cardiovascular disease again. We live very stressful life, and when we show these patients on this number that look at your cortisol level is running really high, now he will understand that it's really affecting the numbers now. But by just saying, oh, you have to live have a stress free life, he won't understand. But when as soon as we put this number that we need to bring this number, when you go to sleep at night time, you need to really relax. You have to forget everything. Just calm down. Watch your deep breathing. In the morning you do that. We explain some techniques. That really helps them. to understand that how they can manage their life personally better. So the advanced testing helps to make sure patient gets that idea clearly. In female, we check their estrogen, progesterone level, DHEA level. So that gives a pretty good idea where they are in this level, cortisol level, and we have to balance it really good before we can really induce good weight loss. Even they do weight loss, it's not possible to happen because these hormones are not in balance. So, and hormone can get into imbalance by multiple factors. The way we live, again, more important is stress, sleep, smoking, and sedentary lifestyle. If we focus on these things, 4S, stress, harmful, sleeplessness is harmful, then smoking is harmful, and sedentary lifestyle is harmful. So four things, 4S are very harmful. If they understand that, see their numbers, and try to get back after 4 months, they're better, they'll stick to the lifestyle better. And now if you look at the overall cost of the health will diminish because now you're really preventing it way before it's gonna develop in the worst case. So it's not like that we're spending money by doing advanced testing, but it really changes people's life and overall health gets better. Okay.